the Honourable Dr Brian Walker.
Thank you, Deputy President. I listened with great interest to both parts of this debate here, and my contribution is going to be a little bit technical. Now, I wasn't in the House at the time all these difficult decisions were being taken. I was, in fact, practising at the sharp end of medicine, facing these life and death decisions at the time, because, bearing in mind, we had seen, as the Honourable Deputy Leader of the House had stated, we were seeing the body bags, and the death rate in China was 10%, allegedly, from the Alpha variant. And that is a terrible number of bodies to be burying. If this had gone on and indeed worsened, it would have been catastrophic. But there we have the actual problem, and that is the fear which arises. I mean, I was in Hong Kong when we had the first SARS epidemic, and there was a 2.5% death rate, and already we were having bodies piling up in the streets, metaphorically, because we couldn't bury them all in time. And that is not a good sign for the public. The Americans left in droves, there was fear and panic, people closed down, banks were shut. So panic is actually very easily obtained when you get these uncontrollable situations. Now, in that situation, and I will ascribe to every member of this House the good intent to serve the people of this great state of ours, and that every decision that was taken with the best of intentions. But as we've also discovered, decisions were made which, with hindsight, might have been better. As a seasoned medical practitioner, I've witnessed a spectrum of vaccine reactions. Look, your sore arm is one thing, mild discomfort, but I've also experienced severe life-threatening injuries, emergencies, anaphylactic shock, which is a lot of fun for a medical practitioner to deal with if you know what you're doing and you manage to save a life. It feels really, really good. But that does point out that vaccines are not without risk. My clinical experience ranges from administering the vaccines, but also treating or seeing cases where a vaccine has not been done or has failed. I've seen one case of tetanus and one case of diphtheria, which basically means that the childhood vaccinations work. I've treated lots of people who've survived polio. Now, that was at a time of an age when the vaccine wasn't as widespread as it was now. Vaccines have saved lives. But what about vaccine safety and efficacy? Now, so I'm going to draw your attention to that critical issue of vaccine safety and efficacy, particularly the COVID-19 vaccines. The gravity of this situation deserves our utmost scrutiny, just as we have recently rigorously reviewed the electoral amendment, Finance and Other Matters 2023 to eliminate potential corruption. We spent a lot of time considering that. But first of all, let's mention here one vaccine that I have personally administered but never taken, as the Japanese bee encephalitis vaccine. Now, catching Japanese bee encephalitis, 1/3 of the people die. 1/3 have irreversible brain damage, and 1/3 recover completely. So you might expect a vaccine should be given to all people at risk. But at the time I was giving this, there was a 1 in 400 chance of a severe adverse reaction. Now, these adverse reactions could be severe allergic, nervous system, cardiovascular side effects, but death was certainly one of the potential side effects of giving the vaccine. So you give a vaccine to save a life, you've got a 1/3 chance of dying, and you've got a significant, not zero chance of dying as a result of the vaccine. That is a little bit of a problem. But this dichotomy is not unique to this vaccine. It's a recurring theme in immunisation, which is one reason why we need to have full medical disclosure and full consent from the parties involved, the doctor and the patient. Now, the thalidomide tragedy taught us the importance of long-term safety studies. It's a lesson seemingly overlooked in this rapid approval of the COVID-19 vaccines. We can all agree to this. Despite personal attempts to report adverse effects, that's my personal attempts, there's been a troubling reluctance to acknowledge these concerns. It's been actively discouraged to report these concerns to the agency. And this discrepancy raises serious questions about the integrity of our health regulatory system. And this is one area where we, as a Parliament, ought to be looking. Are we really having security in our health regulatory systems? This is one area where we, in our pandemic, have to have a close look. Because it's important to have a thoroughly tried and tested vaccine, and that usually requires 10 or 15 years of post-research study and testing. Now, the thalidomide adverse effects were only really brought home after it has been brought into a general use, and then doctors reported this increase in fetal abnormalities. And that was accumulating abnormalities since the drug was introduced, because such abnormalities were certainly also known in very small numbers. But the rapid increase caused people to ask, I wonder why this happened. And so doctors were actively involved in recognising the problem, reporting it, and that eventually led to thalidomide being identified and taken out of service for pregnant women, although it's still in use today. But I had problems in reporting COVID-19 vaccine reactions. It was actually quite difficult, and it was made very clear to me I was an unpopular doctor. So if that is the case for me, and I'm sure for others as well, it's probably true to say that the actual relative risk of COVID vaccination in our city, in our country just now, is probably incorrect, because the levels of reporting adverse reactions is not 100%. And this, I think, is of immense concern. Am I alone in this? So we were told that COVID-19 vaccine would stop transmission of disease and prevent death. Now, neither of these statements is true. Neither of these statements is true. Now, I questioned the Chief Medical Officer on this, and he refused to give details to me in this very House, claiming his advice was cabinet in confidence. Trust the doctor, we're told. But the government's response was based on information which was not correct. And the vaccine mandates, which we then got, were predicated on the truth of these claims, which have been proved to be false. And so people have lost not just confidence in the system because of this manifest incorrect statement, but also people lost their livelihoods, their homes, because of their refusal to abide by what we now know were false assumptions. Now, let's go on, because it might be very hard to believe, but there's 3 senior editors of the British Medical Journal and indicated that the studies which extolled the COVID-19 vaccines as safe and effective cannot be trusted. Why? Because there is evidence of adverse event data having been hidden in similar situations. Now, in our just completed rigorous review of the electoral amendment, we discussed a major component, which was, of course, the shady donations to political entities, which might reduce the potential for corruption if we managed to control that. And we consider that of the highest importance, did we not? So let's compare that and contrast that with the Health Department just now. And the British Medical Journal has published that all the drug regulators, I'll say this quite slowly, all of the drug regulators, like the TGA, the FDA, and counterparts in other major Western countries and the EU, have received the majority of their funding from the industry they are meant to regulate. Now, a question was asked in the European Parliament and answered that the World Health Organization is now 80% funded by industry and NGOs, such as the Gates Foundation. Now, I understand our TGA appears 96% controlled by Big Pharma. Now, I could name names, but I will not do so here today. I'm just pointing out that we have a systemic problem within our system, not just for the pandemic, but for our general health in our great nation. We need to look very carefully at how we are being regulated. Now, as a person who works within the system, I can tell you, I do not trust them. And that's a sad state of affairs, because I should, because they're designed to help us, to keep us safe. Now, there's a revolving door also. There's a big revolving door for lucrative big pharma jobs, which is not an uncommon career move for the FDA commissioners and others who hold a health regulatory position. Now, this exposes our agencies. These are commanded to protect our public safety, but they manifest conflicts of interest and they downplay the adverse events risk. Now, I first came across this when I was looking at the Vioxx scandal and the Purdue Pharma scandal, both in the US, both which resulted in over 100,000 deaths from drugs erroneously approved by the FDA. Now, I'm going to go into some molecular biology, so I'll bore you for a little bit as to why the COVID-19 vaccines are unsafe. And that's because there's a pseudo-uridine-modified mRNA, called modified RNA, mRNA, is long-lasting and produces far more spike proteins over vastly longer time periods. 6 months, according to one study. That's much more than the few hours we were informed it would be by Pfizer, Moderna, and the TGA at the start of the vaccine rollout. 6 months as against a few hours. The lipid nanoparticle carrier envelope for the modified RNA carries the gene code to every organ in our bodies. It's millions of cells that can be transfected and produce spike proteins. The TGA knew this as early as January 2021, and that was only discovered in a Freedom of Information release of their report on the Pfizer vaccine. An FOI was required to identify the problem which they were hiding from us. Now, this is actually why we have adverse reactions which range from myocarditis to blood clots to neurological, autoimmune, skin cancer, and other, quite numerous other reactions. In the case of the AstraZeneca, there's an adenovirus shell encapsulated DNA code. The adenovector shell carries it through the bloodstream and into a wide variety of our body organs, hence a wide array of adverse reactions also reported, including the cerebral venous thromboses, which have killed quite a few people here. Now, a few months ago, I had in my clinic a gentleman who came with neuropathy, painful neuropathy, excruciating painful neuropathy. And despite every single symptom corresponding to the diagnosis of neuropathy, the neurologist refused to make that diagnosis. He could find no other cause, but he refused to ascribe this. Perfectly healthy gentleman, from one day to the other, developed sudden, excruciating neuropathic pain. But he refused to acknowledge neuropathy and refused to acknowledge it could be a potential COVID-19 side effect. Yes, I did try cannabinoids, and no, it didn't work. And yes, he is considering suicide because he cannot live with this terrible situation. Now, in the US, we had a teacher, Brianne Dressen, suffered the same neuropathies in the AstraZeneca phase 3 clinical trial. Her case was deliberately excluded from the paper in the New England Journal of Medicine that AstraZeneca said was safe and effective, and that's what the message was based on. She emailed the chief editor of the New England Journal of Medicine, who replied, telling her to go away, go tell the FDA. And he continued to allow the printing in his paper, his very esteemed paper, that stated that the AstraZeneca vaccine was safe. And he continued, and the health authorities continued to base their decision to call this a safe vaccine based on a paper which had excluded evidence of a serious side effect. Something similar happened to an Argentinian lawyer, Augusto Ru, with pericarditis in the Pfizer trial. Now, his adverse reaction was also not reported in the New England Journal of Medicine. And the TGA based their report on evidence which was excluded. So we're taking the data and we're excluding the unfavourable data, publishing that and saying it's safe. Now, both of their cases are described in the International Journal of Risk and Safety in Medicine, which, unlike the New England Journal of Medicine, does not receive industry advertising money. I think there may be a clue in that. In the meantime, Ms. Dressen, along with other unnamed scientists and clinicians, they set up a website, and a few months ago had compiled over 3,500 published studies of these gene-based vaccines' adverse reactions. So it's simply not science for health authorities around the world to still call these modified RNA and adenovector DNA vaccines as safe. It simply is not possible. Moreover, we've got a comprehensive literature review by an Australian and Swiss German authors, which highlights the synthetic virus-like effects of gene-based vaccines causing illnesses similar to severe COVID-19. And this raises concern about the long-term impact of these vaccines on public health. These are things we ought to be looking at seriously, because this is a scientific observation which so far has not yet hit the public consciousness. Now, myocarditis and pericarditis are now officially accepted as adverse events of mRNA vaccines. However, it's officially said that they are rare. Now, I myself must be one of those rare cases, because I have had myocarditis. And when I attended with my cardiologist, the staff confided in me that they had seen a surge in such cases, but they hadn't been able to report them. They dare not report these. Prospective studies are few, but they suggest that silent cases are common. There was a prospective study of 301 teenagers in Thailand receiving Pfizer and 777 hospital workers in Switzerland receiving Moderna booster. Both studies involved careful questioning and investigations for myo and pericarditis. And they found the rate of myocarditis or pericarditis was 2.3% in Thai teenagers and 2.8% among Swiss hospital workers. Now, a majority of the cases were symptomatically mild or silent and would have been missed or sent home from hospital had they not had specialised scans. But these cases, my case too, possibly have long-term scarring of the heart muscle, and that is a plausible hypothesis for the apparent increase in sudden deaths. Now, the scarring, you see, is a foci for later cardiac arrhythmias, particularly when you're exercising or in the small hours of the dawn when the adrenaline surge happens. I don't know. It's something we ought to be looking at. So we have an unprecedented rate of excess deaths, many of them sudden cardiac deaths, and now also cancers in heavily vaccinated populations that correlates both time-wise with lockdowns and the vaccines. Now, the people who are going to be looking at this most closely is not government and is not doctors, it's actually the insurers, because they are the ones putting out the money to pay for the deaths. And I have been speaking with insurance companies who say, yes, we have to revise what we're doing, because based on the pure finances, there's a problem in our society, one that we haven't fully recognised. Now, I'm not really going to address just now the mandated vaccines. I haven't got enough time to deal with that, but there is untold physical, mental and financial damage to our society. But what we have had here is a government which has had to deal with these issues at a time of great stress, great panic, and been given the information which has been faulty through no fault of the people in this chamber or other chambers around this world, but the information which has been fed to the specialists to feed into the government has not been of the appropriate standard. And you can see why there may well be concerns that the reasons it has not been fed into the appropriate bodies is because of financial gain on the part of those who are seeking to profit from a panic situation in society. I can think of no other reason why you would want to actually put out a vaccine and hide the potential effects, as Pfizer has sought to do, depriving us, the doctors, of the ability to give solid advice to our patients. Which leads me on to the one question I do have, the problem I do have, is that we doctors have difficulty in reporting to the bodies about the adverse effects. And also, if I happen to have a paper which suggests that there's a problem with the vaccine and I mention it to my patient, I will, as many of my colleagues before me, be suspended from my work as a doctor because I have failed to give the government line. And this is a danger to the entire society. When doctors no longer are allowed to give the science, or one version of the science as it currently appears in peer-reviewed published press, because it might conflict with what the government is saying. And APRA, the medical body, is now removing doctors from public service because they have dared to stand up for truth in science. And this I would beg the government to look at most closely, because if there's one group of people, apart from nurses, who need to have the trust of the public, it is the doctors. And if we are not trusted to tell the truth, then the whole underpinning of the trust your doctor for the health of the society is going to be attacked. And I cannot allow this to happen. The necessity for a comprehensive, unbiased and uncensored inquiry into the vaccine rollout is vital. We must uphold the principles of medical ethics, transparency and public safety. It's our duty as representatives of the people. Now, having said that, I will commend the Parliament here assembled for the work they have done and thank all the colleagues who were here at that difficult time. It was a very difficult time. And so I will give every support to the members here who've been through that very difficult time. But let us look and see behind that in more detail, how have we been misled by those other interests about which we at present know very little.